Welcome to my channel. In this video, I explain the causes and symptoms of diarrhea. Watch this video till to end and like and subscribe our channel.
Definition.
Diarrhea is defined as the passage of 3 or more loose or liquid stools per day, or more frequent passage than is normal for the individual. It can be caused by a variety of factors, including infections, food poisoning, medications, medical conditions, and surgery. Discovery of diarrhea. Number 1. In 1875, Friedrich Lösch identified Entamoeba histolytica as the cause of amoebic dysentery, a serious form of diarrhea caused by a parasite. In 1898, Kiyoshi Shiga discovered Shigella dysenteriae, the bacteria that causes bacillary dysentery. These discoveries allowed scientists to develop more targeted treatments for these two common types of diarrhea. The discovery of diarrhea and its causes has led to significant reductions in the number of deaths from this disease. However, diarrhea is still a major global health problem, particularly in developing countries. According to the World Health Organization, diarrhea kills around 525,000 children under 5 years old each year. Causes. Diarrhea can be caused by a variety of factors, including, number 1, infections. The most common cause of diarrhea is an infection in the gastrointestinal tract. This can be caused by viruses, such as norovirus or rotavirus, bacteria, such as E. coli, salmonella, or campylobacter, or parasites, such as Giardia or cryptosporidium. These infections are often spread through contaminated food or water, or through close contact with an infected person. Number 2, food poisoning. Consuming contaminated food or water, especially undercooked or raw meat, unpasteurized milk, or contaminated fruits and vegetables, can lead to food poisoning and subsequent diarrhea. Number 3, medications. Certain medications, especially antibiotics, can disrupt the natural balance of bacteria in the intestines. This disruption can lead to diarrhea. Number 4, food intolerances. Some individuals are intolerant to certain types of food, such as lactose, found in dairy products, gluten, found in wheat and other grains, or artificial sweeteners, like sorbitol. Consuming these substances can lead to diarrhea in people with intolerances. Number 5, inflammatory bowel diseases. IBD conditions like Crohn's disease and ulcerative colitis are chronic inflammatory conditions of the digestive tract that can cause persistent diarrhea. Number 6, irritable bowel syndrome. IBS is a functional gastrointestinal disorder characterized by abdominal pain, discomfort, and changes in bowel habits, including diarrhea. Number 7, traveler's diarrhea. Traveling to regions with different sanitation standards can expose individuals to new bacteria and parasites, leading to diarrhea commonly known as traveler's diarrhea. Number 8, stress and anxiety. Emotional stress and anxiety can sometimes trigger bouts of diarrhea. The gut-brain connection plays a role in gastrointestinal health. It's essential to identify the underlying cause of diarrhea to determine the appropriate treatment. If you or someone you know is experiencing persistent or severe diarrhea, it's important to seek medical attention to diagnose the cause and receive appropriate care. Symptoms. The primary symptom of diarrhea is the passing of loose, watery stools more frequently than usual. However, depending on the underlying cause and the severity of the condition, diarrhea can be accompanied by a variety of other symptoms. These may include, number 1, abdominal cramps. Many people with diarrhea experience cramping abdominal pain. These cramps are caused by the muscles in the intestines contracting more forcefully to move stool through the bowels. Number 2, bloating. The sensation of increased gas or bloating can occur with diarrhea, making the abdomen feel full and uncomfortable. Number 3, nausea. Some individuals with diarrhea may feel nauseated, and in severe cases, vomiting can occur. Number 4, fever. If the diarrhea is caused by an infection, fever might be present as the body's immune system responds to the invading pathogens. Number 5, blood and stool. In certain conditions, such as inflammatory bowel disease or infections, there might be blood in the stool. This can range from bright red blood to tarry, black stools. Number 6, dehydration. Diarrhea can lead to dehydration due to the loss of fluids and electrolytes. Symptoms of dehydration include excessive thirst, dry mouth, dark urine, fatigue, dizziness, or lightheadedness. Number 7. Weight loss. Chronic diarrhea, especially if it's caused by conditions like Crohn's disease or celiac disease, can lead to weight loss over time. Number 8. Urgency. Individuals with diarrhea often have a frequent and urgent need to have a bowel movement. Number 9. Mucus in stool. Sometimes, especially in certain infections and inflammatory conditions, mucus can be present in the stool. It's important to note that while diarrhea is a common condition and often resolves on its own, persistent or severe symptoms, especially when accompanied by signs of dehydration, blood in the stool, or high fever, require medical attention.